I'm Matt Lewis with MLF Legal, and I'm hanging out with Dr. Michael Lopez at Elite Healthcare in Fort Worth. And we're talking about different physical therapies. So active therapy and passive therapy. What is passive therapy?
Passive therapy is typically done at the beginning of an injury. It doesn't require any action from the patient. It's typically your heat, your stim, ice. It's there to make the patient feel better, reduce inflammation, things like that.
And I'm assuming that gets them ready for active therapy.
Correct.
And so what is active therapy?
Active therapy it requires action from the patient. It's your physical therapy, whether it be range of motion, strengthening exercises, things like that.
And at what point in the treatment plan is somebody ready for active therapy?
Usually within the first couple of weeks.
And how long should active therapy continue?
That would depend on the injury.
Well, let's say the typical injury that someone comes in with is probably a lumbar sprain or a strain. So when someone moves into active therapy and maybe they come in with a low back injury, maybe a sprain or a strain to the low back, what kind of active therapy would they expect to do?
We'll do some active and passive range of motion treatments, core strengthening, things like that.
And what benefit do they get from doing that type of treatment?
Their range of motion will start to improve as will their strength.
And if it's a sprain or a strain type of injury, how long would that active therapy continue?
Anywhere from 4 to 6 weeks.
And how often would they come into the clinic for that kind of treatment?
We typically recommend 3 times a week. We seem to get the best results.
What is it about 3 times a week that makes a difference as opposed to 1 time?
It's just coming in consecutively. With each session of therapy, you're building off the previous one. So it's just like if you go to the gym, you're not going to see any gains from going once a week.
So with active and passive therapy, being here when you're asked to be here and as often as you can be here seems to be pretty important.
Oh, of course.
And does that promote the healing process?
It does.
And once they finish the active and passive therapy program, maybe a sprain or a strain type of injury, is that the end of treatment?
Depending on their progress. Some patients, they've been deconditioned. They may require some sort of work conditioning type program to prepare them to come back to work.
But what if they have regained their function that they had before their injury?
Yeah, that would wrap things up.
And are both of these types of therapies the types of therapies that you commonly do for a work injury?
Yes.
Okay. Well, if you've got a sprain or a strain or any other type of injury that requires active or passive therapy, come see Dr. Lopez at Elite Healthcare.